Did you know that cancer can show signs even in its earliest stages? Recognizing these signs in time can make a huge difference. It allows for early diagnosis and significantly increases the chances of successful treatment and even a cure. For some types of cancer, detecting the initial symptoms can offer a cure rate of over 99%. So yes, this is something you should definitely pay close attention to. Even in more aggressive cases, such as pancreatic cancer, early detection can greatly improve the prognosis. Before we begin, tell us in the comments how old you are and what city you're watching from. Your participation matters and helps us create more useful content for you. Don't forget to like this video and subscribe so you won't miss health and wellness tips that could make a big difference in your life and in the lives of your loved ones. Let's get started. These are 10 signs you should be very alert to. Number 1. Extreme fatigue without an obvious cause. That overwhelming exhaustion you feel as soon as you wake up, as if you hadn't slept at all, along with a constant sensation of heaviness in your body, might seem normal in today's fast-paced world. But if that fatigue doesn't improve even after proper rest, it's time to pay attention. Persistent fatigue that doesn't go away with sleep or over time could be an early sign of a chronic illness, including cancer. Certain cancers, like leukemia or gastrointestinal cancers, can cause fatigue for various reasons. They may trigger chronic inflammation, affect the body's metabolism, or lead to anemia by lowering red blood cell counts and reducing oxygen delivery to tissues. This type of fatigue might also come with other symptoms like pale skin, dizziness, hair loss, brittle nails, and even trouble concentrating or carrying out daily tasks. It's important not to normalize excessive tiredness. If you find yourself worn out by activities that never used to bother you, like walking a few blocks, climbing stairs, or even getting ready in the morning, talk to a healthcare professional. While it might be due to less serious issues like stress, hormonal imbalances, or nutritional deficiencies, it's crucial to rule out something more serious. Number 2. Unusual bleeding. Any bleeding that happens without a clear reason should raise a red flag. Whether it's nosebleeds, blood in your urine, when coughing, from the gums, or in your stool, even if the stool is dark, which can mean the presence of digested blood, these signs should never be ignored. Cancer can lead to bleeding by invading surrounding tissues or blood vessels. For example, colon cancer can show up as blood in the stool. Bladder cancer might cause blood in the urine. Lung cancer may involve coughing up blood. In women, vaginal bleeding outside of the menstrual cycle or after menopause can signal uterine or cervical cancer. Keep in mind, not all bleeding is obvious. Sometimes it can go unnoticed and only be discovered through medical tests. That's why any unexplained or recurring bleeding should be evaluated by a doctor with follow-up tests if needed. Number 3. Unexpected thrombosis or blood clots. The development of a blood clot, especially a deep vein thrombosis, DVT, often occurring in the legs, is a serious condition that requires immediate medical attention. If it happens without a known trigger, like recent surgery, trauma, prolonged immobility, or a known medical condition, it may be related to an underlying illness such as cancer. Some types of cancer release substances that disrupt the body's normal clotting system, making the blood thicker and more prone to clotting. Additionally, tumors can press on blood vessels and contribute to clot formation. Smoking is another often overlooked risk factor. Not only does it raise the risk of cancer, but it also increases the risk of thrombosis. Clots can travel to other parts of the body, such as the lungs, causing a pulmonary embolism, a potentially life-threatening complication. If you've had a clot without a clear cause, it's important to get a thorough medical evaluation to rule out hidden diseases, including cancer. Number 4. Skin changes, especially in moles. Paying attention to your skin can be one of the easiest ways to catch certain cancers early, especially melanoma, one of the most aggressive forms of skin cancer. This often starts as a mole that begins to change. It may grow, take on different colors, develop irregular borders, itch, bleed, or rise above the surface of the skin. A helpful rule to monitor moles is the ABCDE method. Asymmetry, border irregularity, color variation, diameter greater than 6 mm. Evolution, any visible change over time. Any of these signs could be a warning. While not all suspicious moles are cancerous, any noticeable change deserves a medical checkup. And contrary to popular belief, you don't need to see a dermatologist right away. a general practitioner can perform an initial evaluation and refer you to a specialist if needed. Number 5. Unexplained weight loss. Losing weight might sound like a good thing, especially if you haven't been trying, but sudden, unexplained weight loss can be a major red flag. Losing more than 10% of your body weight in a short period, like 6 months, without changing your eating or exercise habits could be linked to a serious illness. Cancer can lead to weight loss by altering metabolism. Some tumors release substances that interfere with how the body processes nutrients, or that cause the body to burn through fat and muscle rapidly. As the tumor grows, it may also consume a lot of energy and reduce appetite, resulting in gradual, noticeable weight loss. Of course, not all causes of weight loss are cancer-related. It can also happen due to thyroid disorders, like hyperthyroidism, chronic infections, uncontrolled diabetes, or digestive conditions like celiac disease or malabsorption syndromes. Still, because weight loss can be an early and silent symptom of cancer, it's essential to investigate it thoroughly with a healthcare provider. Number 6. Lumps or swollen lymph nodes without infection. Lymph nodes are small structures in the immune system that act as filters, trapping viruses, bacteria, and other threats. It's completely normal for them to swell when you have an infection, like the flu, a sore throat, or an infected wound. However, when these lumps appear without a clear cause or persist for several weeks without shrinking, they could indicate something more serious. Persistent or progressive lymph node swelling, especially if the nodes are hard, painless, and don't move when touched, can be a sign of lymphoma, a type of cancer in the lymphatic system, leukemia, or other cancers that spread through the lymphatic system, such as breast or lung cancer. The most common areas where these lumps appear are the neck, underarms, and groin. If you notice one or more lumps without signs of infection, like fever or pain, or if you recently had a mild infection and the nodes haven't returned to their normal size after several weeks, it's best to get a medical evaluation. Often, it won't be anything serious, but early diagnosis can help rule out potentially dangerous conditions. Number 7. Persistent and progressive pain. Pain is your body's way of signaling that something might be wrong. While it's often caused by minor issues like muscle tension or stress-related headaches, pain that becomes constant, worsens over time, or changes in nature should not be ignored. If a pain that was once mild and occasional becomes stronger, more frequent, or no longer responds to medications that used to help, it could be a sign of something more serious, including certain types of cancer. For example, a worsening headache could be related to a brain tumor. Increasing abdominal pain may be linked to colon, pancreatic, or liver cancer. Persistent bone pain could signal bone cancer or bone metastasis, when cancer from another area spreads to the bones. The key is to monitor how the pain evolves and how long it lasts. If it disrupts your daily routine, affects your sleep, or requires constant medication to manage, consult a healthcare professional. Progressive pain should never be normalized. Number 8. Difficulty swallowing or changes in bowel habits. If you find it increasingly difficult to swallow solid foods, so much so that you need to mash or blend them to eat, this may be a sign of a partial blockage in the esophagus, potentially caused by abnormal growth such as a tumor. This is a common symptom in cancers of the esophagus, throat, or stomach. Likewise, sudden changes in your bowel habits, without a clear cause, are also important to note. If you were previously regular and now experience prolonged constipation or frequent diarrhea, this could be linked to colon or rectal cancer, especially if accompanied by blood in the stool, abdominal pain, or a constant feeling that your bowels haven't fully emptied. In these cases, a colonoscopy is the most accurate test for detecting abnormalities in the intestines. While stool tests for hidden blood are often used as a first step, if there's any suspicion of cancer, going straight to a colonoscopy is best. It's a preventive test that can save lives. Number 9. Nausea, vomiting, or loss of appetite. Constant nausea, unexplained vomiting, or a noticeable loss of appetite over several days or weeks is another symptom that shouldn't be overlooked. While these can be caused by minor digestive issues, they might also result from chemical changes in the body triggered by certain types of cancer. Cancers in the stomach, liver, pancreas, or brain can affect the digestive system or disrupt hormonal and metabolic balance, leading to loss of appetite, nausea, and even frequent vomiting. When these symptoms are combined with weight loss, weakness, or feeling full very quickly when eating, it becomes even more urgent to investigate the cause. The goal isn't to create panic, but to act with awareness and responsibility. Number 10. Nodules or masses anywhere in the body. Finding a lump or mass on your body can be worrying, but it's important to remember that not all nodules are malignant. Many are benign, such as cysts, lipomas, or localized inflammations. However, any new lump that grows over time or changes in shape should be medically evaluated. A common example is a thyroid nodule. While most are not serious, some may indicate thyroid cancer, which, if detected early, has a cure rate of over 99%. That's why it's vital not to ignore these signs. Nodules can also appear in the abdomen, neck, breasts, testicles, or limbs. In every case, the recommendation is the same. See a doctor for an evaluation, which may include an ultrasound, blood tests, or even a biopsy. It's not about panicking over every lump, but about maintaining a proactive attitude. Catching any abnormality in its early stages makes all the difference. Bonus sign: unexplained high body temperature. If you experience heavy night sweats or feel hot without having a fever or infection, that could also be a warning sign. Nighttime hyperthermia may be a symptom of certain types of cancer. Final thoughts. Being aware of these signs can mean the difference between early diagnosis and a serious complication. The key is to know your body and act if something seems off. Don't wait for symptoms to get worse. Early detection saves lives. And that's it for today's video. Now tell me, did you find this information helpful? Drop your thoughts in the comments. I'd love to hear from you. If this content helped you, share it with your friends and family. Someone close to you might need this information. And of course, don't forget to like this video and subscribe to the channel for more valuable health tips that can improve your daily life. See you in the next video.